Speaking of our local economy and things that support it, healthcare is the largest employer in Worcester and in central Massachusetts, and Notre Dame Healthcare is one of those entities that not only provides quality care, but also employs a number of people, and we're thankful to have Notre Dame as active members of the chamber and involved, and we've had previous guests on the show in the past, and we're pleased to have with us Patricia Thibeault, who is the Director of Marketing and Admissions, and Tracy Larson Benvenuti, who is the Director of Pediatric Palliative Program and the Director of Psychosocial Services of Hospice at Notre Dame. So,
thank you.
Ladies, welcome.
Thank you for having us.
So, as I mentioned, we've had some of the leadership team in the past on the show, but for our viewers who maybe haven't seen it, maybe we could talk a little bit about what is Notre Dame Healthcare and the range of services.
Well, Notre Dame Healthcare, we're actually celebrating 25 years for Notre Dame Healthcare as a whole. Our long-term care facility, most people know us from our Plantation Street location, right, where you have our long-term care facility and our assisted living facility. And what most people don't know is that we have a pretty robust at-home program that was developed with care continuum in the forefront. We wanted to really bring some of the services that we give to our own residents out into the community. So for people who weren't necessarily going to come live on campus, we wanted to make sure that they could receive the same kind of quality care while being in the community.
Right, and so much of healthcare today is, everyone's cost conscious and trying to think of the continuum, if you will,
Exactly.
and ways to meet people's personal needs, but provide it in a cost and effective way. And quite frankly, you all have to be entrepreneurial. As
do.
Insurances don't pay, every cent in the dollar of services provided. The federal government doesn't, the state government doesn't, so you've got to think ways to provide new services.
So the interesting fact is that Notre Dame is in the forefront of providing those services, especially with the federal government. We are one of 3 hospice programs in Massachusetts that started a Medicare Care Choices program, which is a pilot study being provided through the Center for Medicare Services. It's a 5-year study with 141 hospices across the country, only 3 in Massachusetts, and we are one of 3 taking care of Central Mass and Western Mass. This program is trying to provide an alternative to patients who are hospice eligible but not quite ready to elect their hospice benefit and give up life-sustaining treatment.
Mm-hmm.
We're no longer looking at curative treatment as much as we're looking at life-prolonging treatment.
Right.
And Medicare is really trying to say, if we could find a payer source for this, we could actually decrease hospitalizations, decrease emergency room visits. We could allow people to access their hospice benefit a lot earlier than they are right now, and we can allow them to also receive the supportive services that they need while they're, trying to navigate the system of a terminal illness.
Right, and I had a flashback from being in government when you talked about the Center for Medicaid and Medicare Services, and we think about healthcare delivery in this country. Basically all the trains go through that station in many respects.
Yes, so to be one of 3 in Massachusetts and one of 141 in the country is quite an accomplishment for Notre Dame Healthcare and for this area. Massachusetts is a wonderful hub of healthcare services, and so to be able to be part of that study, we are in the 2nd cohort, so we just started January 1st of 2018. We were randomly selected to be in that cohort, and already it's so exciting to see healthcare providers out there looking for another option besides hospice for their patients.
Right, and the Medicare is kind of the federal contribution, correct?
Yes, it is.
And then Medicaid is the state, and so when we talk about conversations with healthcare and covering coverage, it's usually the state and federal government making a contribution or covering all of it, or some combination with, depending on age and situation, and a private insurer might play a role in some combination. So that innovation is driving, and in the same way we think of preventative care and people who are battling various illnesses or challenges, even end of life now is a way to look at cost savings is at home.
Absolutely. And when you say preventative care, palliative care is just one type of care that we can provide to people as far as preventative care. You're really looking at families needing that expertise and that support as they go through their diagnosis, and being able to have a team of people that can help them decide, should I go to the hospital, should I take this medication, should I go for this treatment, is really important. So I think that when we offer a service, a home-based service for patients earlier in their disease progression, they can actually have better information to make good decisions.
Right.
And studies out there have shown that early palliative care actually has a benefit not only on the cost reduction of medical services, but also on the quality of life for our patients.
Patricia, you mentioned kind of being out, a continuum being out, not necessarily on the campus or in the
Correct.
facility, but being out in the community. I assume that experience and having been a pioneer in doing that was probably a factor in you getting designated as a pilot.
Oh, absolutely.
Oh, absolutely. And we do have, again, we are on the forefront of a program that we run. Our PD Pals is what it's known as, but that particular program is also a palliative care program that is based only here in Massachusetts. It's one of the few states in the country that has it, and I really believe that the reason we were chosen is because of the success that we've had with working with DPH, and so the Department of Public Health, actually it's Massachusetts state funded, this particular program. And we've done so much with so little funding, and we're up to about 140 families that have children with life-limiting illness. But again, it's seeing a need for more than just the medical intervention. We are known in Massachusetts, as Tracy said, as a hub for really high quality medical care. But within that, there's a lot to navigate, and even if you've got the best specialists, sometimes it's what you don't know,
Right.
where you really kind of run into some trouble. So
Got
these programs are really coming to the forefront.
One of the hospice programs you referenced was the PD Pals, and maybe you want to explain what that is. We were talking a lot about hospice, and oftentimes there's a connotation that's kind of something towards the end of life, or when someone has a life-shortening illness or situation. Unfortunately, it affects people of all ages, and this new program is kind of new too.
It's fairly new, so it was started in Massachusetts about 8 years ago, when we found that surveys showed that children were dying in Massachusetts but not receiving hospice services because their families were not willing to be able to kind of forego treatment. So the Pediatric Palliative Care Program was started through the Department of Public Health, and it is a contract, and there are 8 hospice programs throughout Massachusetts that are involved with this program. Notre Dame takes care of Central Massachusetts, and now we recently expanded into the Merrimack Valley area. And so it's for children who are residents of Massachusetts under the age of 19 and have a life-limiting illness. They receive free services that does not interfere with their insurance at all or their medical treatment. It's home-based services. Services include social work, nursing, spiritual care, music therapy, massage therapy, volunteers, bereavement services. Because as you said, children do get sick in our lifetimes, and unfortunately some of these illnesses can go on for many, many years. So families are looking at really a long prognosis and diagnosis sometimes with these children.
When we think about it, it's a traumatic, difficult
Absolutely.
thing for the child and for the families. But there's a way to guide and assist people, and to be able to have that service and someone or a team of people along with it. It's, as the provider, is probably challenging and heart-wrenching, but in some ways probably rewarding as well.
One of the things I've always said is that we can't change the diagnosis, we can't change what's happening, but we can help the families along their journey. And as you mentioned, having a team of people that can help them along with that journey at different times to understand what's coming up next, what to expect, how do I talk about my doctors with this, or even better, how do I talk about this with the siblings? You know, there's a lot of children out there whose siblings are just trying to make it through the day, go to school and live like a normal child, when at home things are really rough. And so having a team of people can kind of help make the journey just a little bit easier.
Right, right. And so, you know, both programs, you know, a pilot funded by Medicare, this program, a contract with DPH. You know, if there are viewers or people out there who want to learn about these programs or the range of services that Notre Dame Healthcare provides, how can they get in touch, learn?
They can go onto our website, www.notredamehealthcare.org. They could also call at 508-852-5505. And it's funny, we're one of the few places, I think, that we don't have a call center per se. We literally answer the phone within 3 rings. You'll always get a person, and then we make sure to get you to the right, you know, whether it be intake or nursing or social work. But everybody there is hands-on and educated on
And you're
this.
located conveniently here in Worcester.
We're right on Plantation Street, not far from UMass.
Beautiful campus.
Oh, beautiful
Yeah.
campus.
Yes.
And the campus has, you know, assisted living, long-term care, and the Education Bridge Center. So it really is just a beautiful campus.
And we just got a minute left, but we were offline. You brought up something which was not something we kind of anticipated as a conversation, but you know, internships. You work with many of the colleges, and healthcare is the biggest employer.
Yes, yes.
Almost every one of our schools have, you know, colleges have healthcare related programs, or most of them, and that's something you guys welcome and are
We
involved in.
Very
welcome, you know,
much,
the
very
mission of the
much.
Sisters of Notre Dame really is surrounded by
Education.
education. And so, you know, this is our way of giving back to the community, bringing students in from all different types of disciplines and being able to provide them with a start. And then, you know, hopefully they might want to stay and work for us.
Right.
So
And they're
we
great ambassadors too.
Oh,
You
absolutely.
know, they're out in that healthcare community. So even if they don't choose to stay with us, now they know what it is that we're doing and how important that work is,
right.
and that's not a bad thing either.
Good stuff. Well, we you know, I say it oftentimes, the single biggest issue we hear from our members is workforce pipeline, and we say part of the solution is internships if at all possible.
Yes.
So to have people doing that and talking about it in such glowing terms, we're going to hold you
yes.
guys up as an example. So thanks for being with us, and really thank you for the innovation. You know, Massachusetts is certainly an innovation hub, but we want Worcester and Central Mass to continue to be a part of that game-shaping
plan.
delivery system. So thanks for being with us.
Thank